Hi everyone, this is Ted Hartwell. I'm on the research faculty at the Desert Research Institute, and I'm going to provide another update on tribal gaming and also where we are with COVID-19 and some of those states where gaming first reopened. There's my contact information on this slide. If you have any follow-up questions or would like to get a hold of me or would like me to provide additional information in an upcoming briefing, just reach out to let me know, and I'll do my best to provide that. So here's where we are as of July 17th on casino reopenings across the country, with the blue being those casinos that have reopened. 842 are now open, 147 are closed. The shield-shaped casinos are the tribal casinos, and the square-shaped ones are the commercial casinos. As you can see, there are still a number of closings across the country, both commercial and tribal sector. In fact, I think there have only been 3 casinos that have opened in the past week since my last update. All of those were commercial casinos. This information you can find on the American Gaming Association's website. They update these on a daily basis, and the link is at the bottom of this slide. Here's another way to visualize that kind of from the very beginning. There were 524 tribal properties and 465 commercial properties that were open at the beginning of the March, and then by mid-March virtually all of those had closed, and then all of them had by early April. The first one to open back up was tribal casino, the Coeur d'Alene, up in Idaho on May 1st, and since that time 82% of tribal properties have reopened, and about 80% of commercial properties have reopened. I think there's one additional commercial property that has reopened that is not included in this number. That should be 412. But by and large, the great majority have opened at this point. I produced these slides during my very first presentation to the Native Waters on Arid Lands group almost exactly a month ago on June 18th. And I used some of the slides that are produced by time.com based on the Johns Hopkins rolling 7-day averages of new daily cases per 100,000 people. And I thought it would be interesting to include the first casino reopening in each of the states where that first occurred. In some cases these are tribal, in some cases they are commercial, but there are some interesting trends to note in all of these states. The very first property to reopen, once again, was Coeur d'Alene up in Idaho on May 1st, and you start to see a little noise a couple weeks out, but really not a significant increase until we're a little ways into June. And one thing that these graphs do is really highlight how much change there has been just in the past month. The slides on the left are from my original presentation back on June 18th, and then the slides on the right are from today, July 17th, for those same states. You can see that in a lot of cases the scale has changed pretty dramatically. For example, in my first presentation, the new daily cases were just basically increments of one person, and now that's gone up 5-fold. It's increments of 5 people per day in order to accommodate the increase that we've seen since the beginning of June or mid-June there, with no end in sight, unfortunately. One thing I want to add also is that I'm in no way trying to imply that the reopenings of these casino properties were directly responsible for the later trends that we see in COVID-19 increase in cases. But they may very well serve as a good proxy for the beginning of relaxation of some of the measures implemented by various states, as well as a general relaxation of attitudes that it might have been okay to go out and engage in business as usual. And so these reopenings may serve as good proxies for other things that are going on in that state. Similarly, in Montana, early May, earliest openings, and then 2 to 3 weeks out in that, we see a pretty marked increase in cases, again, which has not slowed down as of the timing of this presentation. Up in Washington State, again, fairly early in May, the earliest reopenings actually had a downturn for a couple weeks, and then since that point in time, there's been a near continuous upturn in the number of daily cases per 100,000 people. Another thing I want to mention about these particular graphs is that these are rolling 7-day averages. So each data point basically represents an average of the number of cases in the 7 days immediately preceding that day. I like the 7-day averages in that I think they provide a more complete picture if you want to look at trends. Sometimes if you look at the daily data on a lot of these charts, depending on what you're looking for, it can provide either a false sense of security or maybe a false sense of alarm simply based on the data for that one day. And because of the lag time sometimes in reporting positive cases, as well as how a state may report its own data, how it may gather that data, it gives a more accurate picture to look at some of these charts when you look at either the 3-day or especially I think the 7-day rolling averages, which I think give a more accurate picture of what's going on. Just something to remember as you're searching for data online or as you're watching these reports on TV. Of course, depending on the news station, some of this information may be slanted in one direction or another, and so become familiar with what these really mean as you're looking at them, and so you can kind of wade through some of the rhetoric sometimes, because there's tons of great data out there, and most everything that you see in the news is good data. The graphs present accurate information, but it's important to recognize the context and what these things actually mean when you see them. South Dakota is one of the few states where we're seeing this positive longer term trend. Those of you who saw my briefing last week, I noted a little bit of concern looking at last week's data. Early in July, we were starting to see this little potential increase. If you remember, President Trump had his big outdoor rally with thousands of people, very few of them wearing masks at that time, and I had kind of wondered if we might see an increase, but that does not seem to have been borne out, and we actually have seen a decrease to this point over the first couple weeks of July, which is good news in South Dakota. Arizona was another state where some of the data from last week had just started to flatten out, and it does look like, at least over the past week to 10 days or so, that trend has continued to decline. Again, recognize that these graphs I'm showing right now represent new daily cases per 100,000 people. So while the new daily cases are on their way downwards, it's important to remember that some of the other indicators do lag behind. So we are continuing to see increases in hospitalizations and increases in deaths in Arizona, specifically because those factors are catching up to that very long-term increase we saw over the previous month. So you can expect those measures to actually increase for a while, even though the daily cases have started to go down. So again, very important to remember as you see these data being presented online, to remember about these lag factors, because it's easy to cherry pick one out and say, here's an indicator. Oh, look, our deaths are going down. Even though people are reporting cases are going up, this is nothing to worry about because, look, our deaths continue to go down. Not necessarily the case. It more likely means that that is just a lagging indicator that we haven't seen show up yet. In California, more of the same, unfortunately, continuing to see those daily cases per 100,000 people go up. And then finally, with Nevada, you remember that I had reported last week that we had seen a flattening, at least of those new daily cases per 100,000 people. And I was encouraged that might be an indicator of the masking requirements that the governor implemented at the end of June, which required everyone to wear masks indoors in any public facilities or businesses. And indeed, about a week out from that directive, we did see a flattening for about a week. But unfortunately, over the course of the last week, the upward trend has continued. So that flattening was somewhat short-lived. I hope we'll see that turn around, but for the moment, not good news. I wanted to include a couple new graphs in this presentation that give you an idea of how these different trends can be portrayed. This is from Nevada Health Response website, nvhealthresponse.nv.gov, and there are several charts that are updated on a daily basis that can help you find different data depending on what you're looking for. In this case, this is a graph, again, as of today, July 17th, that shows confirmed and suspected hospitalizations over time. And you can see, again, over the past month or so, there has been an increase over time in both confirmed and suspected hospitalizations. We are, currently at the highest number of hospitalizations due to COVID-19 that we have experienced during the pandemic. You'll notice a little bit of a flattening towards the end in this chart. That may be related to the flattening that actually happened a week or so before that on the new cases. Again, remember, hospitalizations are going to lag behind. People get tested when they're feeling ill, and those that test positive may not at the time feel like they need to go to the hospital, but then over the coming week at some point, a certain percentage of them need hospitalizations, and so again, that indicator will lag behind the positive cases, and we may see over the next week that number begin to go up again. And then again, confirmed and suspected intensive care unit and ventilator use by date. You can see that again we are at the highest we have been to date in terms of our intensive care unit use, and we are getting back up in terms of our ventilator use through time. Here's another map from yet a different graph on that same website that shows the test positivity rate through time, and there are a couple different lines on this chart. These again are Nevada as of July 17th. The blue line shows the test positivity rate through time, and it basically is a cumulative figure. So it looks at all of the tests that have been done up to a specific date and all of the positive results from those tests, and then computes that percentage. The orange line is basically a 7-day moving average of the same thing. So each of the data points represents an average of the previous 7 days positivity. The green line is the World Health Organization goal. Reaching that 5% positivity testing rate it is very important. Nevada was down below that in terms of its 7-day moving average for quite a while, and really close to that in its cumulative average as recently as mid-June, but you can see both of those have increased markedly during the last month. So what does that mean, those test positivity rates, in terms of that WHO goal? And this is a quote off the Johns Hopkins University website, another excellent resource of data and graphs on COVID-19 that I would encourage you to visit. So if a positivity rate is too high, that may indicate that the state is only testing the sickest patients who seek medical attention and is not casting a wide enough net to know how much of the virus is spreading within the communities. And a low rate of positivity in testing data can be seen as a sign the state has sufficient testing capacity for the size of their outbreak and is testing enough of its population to make informed decisions about reopening. So currently, Nevada has a ways to go to get back down close to that 5% so that we have a good handle on how the outbreak is occurring and spreading within our communities. One final chart from yet another resource that I wanted to let you know about, and this is from the Institute for Health Metrics and Evaluation from the University of Washington. This has been a model that has been cited by both the White House, other organizations, right since the beginning of this outbreak. And again, it is a model, so it shows not only real data up through today, but it shows projected data out into the future based on certain parameters. So those of you that are interested in seeing where your state has been and where it may be going in anything from daily deaths, which is what this current chart shows, to test positivity rates, to hospital resource use, other trends through time. What will that look like if we all wear masks? What will it look like as we ease restrictions? What's the current projection? All of these types of data are available through this website, and you can also compare between various states to see which ones are doing well, which ones are not doing well, and you can change the parameters yourself to see, how many fewer deaths will we have if we implement a certain measure. In this case, again, this is Nevada. You can see we're on a current upward trend. We're about as high as we have been at any point in the past in terms of our number of daily deaths. And we're up close to about 8 average a day. And you'll notice, unfortunately, this line goes upward fairly steeply regardless of what measures we have. Again, there's going to be that couple-week lag where that trend is going to continue. With universal masks, that trend can be reversed and flattened down to about 5 per day. If we do nothing and ease restrictions, then by November 1st, it's projected that we will be up to more than 40 deaths per day by November 1st, which of course we all would like to avoid. So just a few take-home messages from this and other presentations. Number one, there are lots of great resources out there for viewing data. By and large, they are mostly excellent resources, but know, number one, what you are looking for. What is the information you are really trying to get at? And number two, know what you're looking at once you pull up that graph. Make sure you understand exactly what it's showing you, whether you're looking at daily numbers or 7-day averages to produce those trends. Also look at the source that is currently showing you that graph, and you can probably figure out on your own where the bias of that particular media source may lie. But feel free to reach out again with any questions. If you would like me to include some other states in these data that I don't currently have, or some other data points, I can try to take time to do that, and hope to have more information for you next week. All right, take care.